Hi, Becky.
Hi, Allie.
I'm with Becky Maidansky, a physical therapist, a doctor of physical therapy, specializing in the pelvic floor area of the body. So definitely working a lot with people who are pregnant, postpartum, preparing for birth. You have a whole lot of experience. I've read 10,000 hours of clinical experience working as a pelvic floor physical therapist. And Becky is the owner of Lady Bird Physical Therapy, which is a perinatal specialty clinic here where I am in Austin, Texas. But also you work with people all over the place, especially because you do things online, you do things virtually, you do amazing things in Instagram. It's one of my favorite places to visit on Instagram. So check out Lady Bird PT for sure. A lot of, just fun things to watch, but also so informative. And so today the focus is to talk about a new class that Becky will be teaching at Breastfeeding Success. And I asked you to do this because I go way back with Becky. We both rented space in the same building in South Austin. I believe you were new to Austin then, right?
Probably a couple years. Yeah, okay. A couple years, new-ish.
And so I had benefited so much from pelvic floor PT at that point after my second baby was born. And so when I met you and I knew what you did, I was so excited to hear all about what you did and tell you about my experiences with pelvic floor PT. And so then when I started teaching at Breastfeeding Success and we kind of went our separate ways as far as the building went, I was teaching virtually and I reached out to you to make a video for me for virtual birth class students, which has been amazing and so helpful for so many people, a great educational video. And then since then, your practice really has just exploded. You've got your own space, a great team, all your great Instagram content, now a brand new baby, which I think has been making Instagram following of you even more fun. So that's all I know about you, Becky. But what I don't know a whole lot about quite yet is what your class is going to be all about, all the details of this new class you're going to teach. So can you kind of talk about that?
Yeah, well, thank you so much for the introduction and all of the very kind words. We've known each other for a long time. I kind of forget how long we've been connected. I think that was like 2019?
Yeah.
Probably, yeah. Right before COVID. But yeah, I'm so excited to be working with Breastfeeding Success and teaching this birth prep course. We're going to be diving into how to prepare your body and your pelvic floor for birth, but also kind of through pregnancy and for postpartum recovery. I think oftentimes when we talk about how to prepare for birth, we forget that there are many months of pregnancy leading up to birth. Birth is this quick snapshot. Even when it takes a long time, it's still worst case scenario, a couple of days. And then postpartum recovery is long. And so this class is really going to be focused on preparing your pelvic floor and your body for all people need to know about pelvic health throughout that whole snapshot of time and as much as we can get through in 2 hours.
Yeah. So I guess if you could say, like, what is your biggest, if you had to pick one thing, goal for people leaving this class, what do you want them to take away mostly?
Yeah, I think a lot of people are getting their information on pelvic health from social media and from the internet in general. And there is so much conflicting information out there. There are so many myths, and there's also just a lot of information that doesn't apply to all people. So I'm really hoping that when people take this class, they walk away feeling much more confident in their understanding of what the pelvic floor actually needs to do for them through pregnancy, birth, and postpartum recovery, as well as what they personally can start doing. There is no one-size-fits-all approach. This class is going to talk through all the different potential situations that somebody might find themselves in and what actions they can take if this sounds like them, or if somebody has more generalized weakness, if somebody has more tightness in their body, what they specifically can be doing to prepare their bodies for birth and for postpartum recovery. So I really just hope that people walk away feeling much clearer on what is and isn't true, what the evidence does and doesn't say, and how that evidence might apply to them, as well as if they need more information, where they can go to get that personalized help.
Yeah, agreed. And I mean, as a birth teacher, And, I can't go into detail about this kind of stuff. I don't have the level of education and experience that you have related to the pelvic floor. I can just give people little general bits of information. But you're right. So often in the classes, I talk to people who have gotten general bits of information from maybe the wrong places. And there's a lot that they don't know. So I am really excited for them to have this class. Any one little piece of information from the class you might want to share? Any kind of maybe a sneak peek, a little tip, a hint?
I think that, well, I wanted to share a little bit about what the topics are that we're going to be covering, and then maybe we can share a hint just so that people have a little better idea of what they're signing up for. I mean, we're going to be talking about how to basically optimize birth outcomes to optimize postpartum recovery. This is the information that I wish was part of every childbirth education class. There is so much that people get out of childbirth education, traditional childbirth education, and it's so necessary to set people up for what to expect, understanding what their options are, to be empowered throughout birth, but knowing how to prepare your body and how to even manage your body through pregnancy and through birth, I think is also really integral to an optimal birth experience, whatever that means for the person, however birth ends up appearing. So as far as one specific tip, I think that the one of the biggest things that I would like to debunk and talk about is what Kegels are and what they mean for birth prep specifically. I think there's a lot of information out there about whether you should be doing Kegels, whether you shouldn't be doing Kegels. And first of all, I think if you don't know what Kegels are, that's a great place to start. So what we will not be doing in class is teaching everybody to Kegel through pregnancy, but understanding, so just starting with what they are. So a Kegel is a pelvic floor muscle contraction, the same way that a bicep curl is a bicep muscle contraction. So we're going to be teaching you how to control your pelvic floor, which comes with, can you do a Kegel? And then can you feel the muscle relax? But it's just a strengthening exercise. Not everybody needs pelvic floor strengthening through pregnancy. So not everybody needs to be doing Kegels through pregnancy, whereas some people do. Some people head into pregnancy with a really weak pelvic floor. And so strengthening is actually important. What we're going to be talking about is how you can figure out whether or not strengthening is something that you should be doing, as well as if it is something you need to be doing, what are some ways that you can begin doing so. But the Kegel controversy really comes from a place where people have been historically told that the way you prepare for birth is via Kegels. And we now know that your pelvic floor doesn't actually need to be strong to push a baby out. It needs to be flexible. So if you're strength training without flexibility training, without mobility training, then we're not setting your body up for success.
Okay. So you'll be talking about both of those things in your class. Okay. Great. Thank you. I'm so excited. So this class is going to be, the first class is on April 14th at 1 p.m. Central Time. That's a Monday. It's kind of going to be a lunchtime class. So hopefully people can take a break during the workday to come take this 2-hour long class. It will be live virtual. So using this same format we're using to do this interview, you can actually talk to Becky, see Becky, ask Becky questions during the class. The cost, the out-of-pocket cost is $75, but Breastfeeding Success can also submit a claim to your insurance company if we're in network with your insurance as a birth preparation class. And we are in network with Aetna, United, Blue Cross Blue Shield, HealthSmart, Baylor Scott and White, HEB, Blue Cross Blue Shield, ARC, Employee Health Plan. There's a couple of plans in there that don't cover virtual classes, but we can verify that when you sign up and let you know if it doesn't. But that's all I have. Again, just so excited to welcome you to Breastfeeding Success and to get to offer this class to everyone who wants it.
Thank you so much for having me. I'm so excited to be part of the team, and I'm really grateful to you for facilitating it.